I'm a psychiatrist in San Francisco with a mostly psychotherapy practice. I was a published psychotherapy researcher early in my career, and for decades, I've taught psychiatry residents, that is, doctors specializing in psychiatry, about psychotherapy. Today I'll talk about how some therapists see themselves as political advocates for their patients and why that's a big mistake. I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. Many therapists and writers about therapy repeat the truism that psychotherapy is political. And indeed it is. The political history and the current political reality of therapy molds a great deal about it. What counts as a mental disorder, how therapy gets paid for, why people see professional therapists instead of just talking to their family and friends, and many other aspects. This isn't particularly different from looking at the political roots of everything else in society. Why we have the educational system we do, the criminal justice system we do, how certain foods show up in our grocery stores and supermarkets and other ones don't. Basically, everything in our lives exists in a political context. But all too often, this reality that politics involves just about everything gets confused with the idea that politics should be included within therapy itself, with therapists being political advocates, often positioning themselves as fighting oppression in one specific way or more generically. I'm going to argue here that there's a big difference between appreciating the politics surrounding psychotherapy and incorporating it in therapy itself. A useful concept here is called externalization. Patients or clients who see their problems as existing outside of themselves, mean bosses, unreasonable spouses, they don't come to therapy to change anything about themselves. They might come for validation or emotional support, but not to change themselves. In the traditional language of psychotherapy, these patients externalize. They put all of the responsibility for their troubles on the outside world, which psychotherapy really can't do anything about directly, and they deny all responsibility for their own plight. Typically, therapists are quick to challenge this view when it comes to bosses and spouses. After all, therapy can't change other people, only the person in the room, the client or patient. It can only help the client or patient see things differently or have different feelings about it or behave differently. An early step to making progress in therapy is to set aside externalization and instead to ask, what can you do to make your marriage better, or to get along better with your kids, or to advance your career? How can you make your life more meaningful or less lonely? At a deeper level, psychotherapy is all about how are you preventing your own best self from coming out? How are you keeping yourself so stuck? Now, curiously, despite identical logic, many therapists today accept or even encourage externalization when it comes to social ills, such as racial or gender or economic inequities. They see their role as providing support and validation and advocacy. They believe that focusing on the patient or client's role in the problem is, quote, blaming the victim. A lot of what's called therapy these days, and I use the term therapy in contrast to psychotherapy to talk about a kind of sloppier and more inclusive concept. I discussed that in a video here. Most therapy aims to be non-stigmatizing, non-pathologizing, to be supportive. Some therapists make this a kind of calling card. So-called trauma-informed therapists often make a special point of saying that the patient's suffering is a normal reaction to an abnormal situation. That's supportive, but it leaves out the fact that people have different reactions to abnormal situations. The same trauma that happens to different people can result in different outcomes. And that has to do with the person's genetics and their early development and maybe the coping skills they've learned along the way. There are better and worse ways to respond to trauma. Feminist and gay identified or ethnically identified therapists sometimes base their work on a shared group identity, that they're members of an oppressed group and that their clients are as well. This implies empathy and kinship with clients in the same group. This is all very seductive, and of course there's some truth to it. It feels validating to both parties. It kind of jump-starts the therapeutic alliance, the ability of the therapist and client to work with each other. Instills a certain degree of trust. It's certainly not all bad. And it also conveniently puts both parties on the same side of a split. We're the good guys, we're the oppressed guys, we're the guys in the same boat. And those others, the oppressors, the tormentors, the fascists or racists, or if they're conservative, the liberals, libtards, they're the bad guys. They're on the other side of the split. Now, as I say, there are some benefits to feeling that kind of kinship between the therapist and the client. When they identify with each other, the client feels heard, feels validated, it feels supportive, but it also introduces a whole string of problems. First, it's an oversimplification of reality. It encourages splitting, which is a technical term in therapy for seeing the world as all black and white. There's good and evil, and there's nothing in between. There's no shades of gray. It's a kind of oversimplification of the world. In the theories of psychotherapy, it's actually a more primitive defense mechanism than even externalization is. It's what little kids do when they're 2 years old, when they first learn to say no. You know, I'm me, you're you, we're different. It's all one or the other, the good guys and the bad guys. Splitting feeds extreme views of oneself and other people. It contributes to all that political polarization that's in our society now. And worst of all, it doesn't help. It doesn't help the person feel better. It just makes them more victimized. It reinforces the roles that they already came in feeling. It promotes a primitive fight or flight duality. It doesn't really encourage creative, subtle alternatives for finding solutions to problems. Number two, if you're a therapist who politicizes your therapy practice, it means that people who disagree with you politically can't get help from you. People with other political viewpoints need empathy and a listening ear, not a lecture. Consider this thought experiment. Suppose you're a therapist with strong political views and someone comes to see you with opposite, really opposed political views, but they've been inhibited and ineffective for psychological reasons. How would you feel about working with them to make them a more effective, constructive person out in the world, espousing those political views you don't agree with? What if your work with that person in therapy made them a better activist on the opposite side of issues that you care a lot about? In other words, what comes first? Your role as a clinician, as a healer, or as a political activist? Number three, there may be assumed agreements based on group identity that really don't hold. For example, being gay and assuming all gay people feel the same way, or female, or Jewish, or African American, or anything. All of those groups have differences of opinion within them, and yet there could be a kind of stereotype based on the mere fact of group identity. Even more subtly, a shared group identity may stop the patient from voicing feelings or opinions that clash with the general feeling of that group. They might assume that the therapist will disapprove. For example, I once had a patient who very hesitantly confessed to me in therapy that they didn't agree with all of the progressive politics here in progressive San Francisco, and they assumed that I endorsed all those policies and that I would disapprove of them admitting that. Now, we can work with assumptions like that about the therapist in therapy. That's an aspect of what we call transference, the assumptions that the client or patient makes about the therapist, and it reveals something about how they see other people. We can work with that if it's the patient's imagination, if it's their transference. But what if it isn't? What if the therapist has made it crystal clear that they approve of certain things and disapprove of other things? That's not transference then, that's just the patient feeling like they can't talk about certain things. I remind you that mixed or conflicted feelings are very common, and they underlie many common problems people see therapists for, like depression and anxiety. Discouraging the expression of mixed feelings or doubts is not therapeutic. Number 4, a shared group identity can obscure blind spots, cultural blind spots. Or to use a technical language, it promotes colluding with the patient, sharing unhelpful but usually unstated attitudes. It promotes what we call transference, countertransference enactments. That's a mouthful. That means basically that the therapist and the patient kind of play out a certain kind of interaction without really being conscious of doing so. For example, this could reinforce each other's sense of victimhood. Number 5, as I talk about in this video, psychotherapy reflects a dialectic. Dialectic is an apparent paradox of opposite concepts that, taken together, reveal a greater truth. In the case of psychotherapy, that's the idea that on the one hand, it's important to change, and on the other hand, it's also important to accept yourself the way you already are. Neither blaming yourself nor completely denying responsibility is helpful. Political advocacy collapses this dialectic. It ignores the inherent tension that makes the human mind so complex, that nearly all of us harbor mixed feelings about most things, and that we're far more complex and nuanced than simple political slogans or party platforms. And number 6, and perhaps most important, therapy is the wrong tool to affect political change. I'm reminded of a tension back in the 1960s between the hippies on the one hand, who would look within themselves, tune in, turn on, drop out, use psychedelics, meditate, and so forth. And at the same time, there was a very active political activist group who didn't really do those things, but tried to change society politically. Now, it's true that a single person could do both things, but not at the same time. You're not overthrowing the ruling class while you're meditating at the ashram. And you're not meditating or centering yourself while you're on the picket line or at a protest. Politicizing psychotherapy, a place to work on yourself, is like using a pair of pliers as a hammer. It's a good tool, but not for that purpose. And in using pliers as a hammer, you damage the tool. It can't even be used for its intended purpose after that. Now, needless to say, not all therapists and patients can work together. A gleefully misogynist or racist patient or client may offend and anger a liberal therapist so much that they can't work with them. And conversely, a client or patient who keeps intoning progressive talking points may so frustrate or anger a conservative therapist that they can't work with that person. We're all human, and there are limits to what we can tolerate in working with another person. These limits should be wide, though. You know, surgeons have to deal with the sight of blood. Pediatricians have to deal with screaming kids. Dermatologists have to look at ugly skin rashes. And I was told a long time ago by a psychotherapy supervisor that a lot of people who come to therapy have personalities that are difficult or have attitudes that are awkward or we don't like. That's why they're coming to see us, just like the dermatologist sees the ugly skin. That's the job. Therapists have to work with personalities and viewpoints that we might find offensive. We have to be open-minded or dedicated enough to put our own political viewpoints on hold. We treat people who've committed criminal acts or cruel or violent acts, people who rage at us even though we haven't done anything wrong, people who've made life choices we would never make. Given all that, are we really going to refuse to work with people who vote differently than we do? Isn't that petty? Isn't that beneath the dignity of a mental health professional? Isn't that what being professional means? A strong working alliance does not require political agreement. As a matter of fact, if political talk serves a defensive function, for example, externalization, it's the therapist's job to help the client recognize that defense and to look past it, beyond or under it. In that sense, therapy may be more effective when the patient or client and therapist disagree a little bit politically, so that they don't share the same blind spots or collude in a defensive way. Well, that's it for this time. Please share your thoughts in the comments below, and I am quite interested to read what you have to say. Please like this video, but only if you really like it. Please subscribe if you have not already. And if you like this video, you might like this one too. I'll see you next time.